So please continue to connect. I know many of you are still connecting, but welcome to our town hall. Thank you for joining us. I would like to welcome our honorary guests, the Consulate General of Peru, our Cuso International board members, alumni, and compassionate donors, and all of you who are joining us. So thank you. My name is Tina, and I'm the Outreach and Partnerships Officer, and I'll be facilitating from Toronto, Ontario. Today, you're going to hear a conversation from Pilar Garcia joining us from Lima, Peru, and Tanya Shepard in Ottawa. They will speak to the impact of COVID-19 on women and girls and how Cuso is managing through the pandemic. I would like to start us off with a land acknowledgement from where I am in Toronto. The traditional territories of many nations, including the Mississaugas of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat peoples, and is now home to many diverse First Nations, Inuit, and Métis peoples. We acknowledge that Toronto is covered by Treaty 13 with the Mississaugas of the Credit. So let's get right into it. First, some housekeeping. I would like to mention to please feel free to ask questions. If you can use the Q&A box, that would be ideal. And for those of you using a computer, you can also participate in our polls. Polls will be questions that pop up on your screen, and you'll have an opportunity to select your answer. And we'll make time that we go through the results. But let's try a poll right away. So the question that you should be seeing on your screen for those of you using a computer is, have you ever traveled to Peru? You have the selection of yes, no, no, but I would like to. So I'll just leave that up very briefly, just for a couple of seconds. 5, 3, 2, 1. And don't worry, we will share those results with you. As I mentioned, today's town hall will be in the format of a conversation between Pilar and Tanya. And following that conversation, Tanya will share insights on Cuso's programs in Colombia and Honduras. But first, let me properly introduce our guests via their bios. Pilar is Cuso's country representative for Peru. She has over 16 years of experience in international development programs and interaction with local and multinational stakeholders. Her capacities are with large projects, human resources, and volunteer management, in which she has developed partnerships and led programs on gender equality, economic opportunities for women and youth, sexual and reproductive health. She has worked in Nicaragua, Honduras, Colombia, and Peru. Pilar has a deep understanding of the region and world's development context and enjoys working in multicultural settings. She has a bachelor's of law and a master's degree in international development. If you could just unmute yourself and say hi so everyone can see you very briefly, Pilar.
Hello, I'm really glad that you're here. Nice to meet you.
Excellent. And Tanya Shepard is head of programs for Latin America, the Caribbean, and Southeast Asia. Tanya has worked in international development sector for the past 20 years with direct experience working in Bolivia, Brazil, and Chile, with a specific focus working in community-based development, women's rights and participation, and youth economic empowerment. She has a strong project design and management experience overseeing the implementation of large bilateral projects financed by Global Affairs Canada, and most recently, the European Union. And Tanya, if you can just unmute yourself and say hello so everyone can see you.
Good morning, everyone. Thank you for joining us today.
Excellent. So I would just like to mention that please be patient. Technology from all these different countries comes with some risk, but we are doing the best that we can. And I will start us off with a general question. Pilar, maybe starting us off with the context of Lima, Peru, some facts about the region, the demographics, and the economy.
Okay, well, thank you again for being here to hear about Peru and what we're doing in the region. Peru is an amazing country. It is home to 32 million people distributed into 25 regions that are marked by 3 geographical areas that are the La Costa, the Pacific Coast, La Sierra, the Andian Mountains, and La Selva, which is the Amazon jungle. The capital city is Lima, which is home to 10 million people. Peru shares borders with various countries in South America, including Ecuador, Colombia, Bolivia, Brazil, and Chile. It is a very rich country in history, culture, and immense in natural resources. Unfortunately, there are still inequality. It is very marked by inequality. And even though the World Bank classifies Peru as an upper middle income country, there are huge gaps still in place. And that is why organizations like Cuso International and other cooperation agencies are still here joining the efforts of the government for the development of the country. Peru is also well known by its gastronomy and one of the new wonders of the world, Machu Picchu, that is located near Cusco, which was the former capital of the Inca Empire.
Thank you for that, Pilar. And now we will start our official town hall with a conversation between Tanya and Pilar.
Thank you, Tina, and thank you, Pilar, for being with us from Lima, Peru. I've had the opportunity to work alongside Pilar throughout the years, both in Nicaragua and now in Peru. So Pilar, I'd like to ask you a few questions so our listeners can better understand the current context in light of COVID-19 in Peru. So my first question is, can you share with our listeners a bit about what quarantine measures that have been put into place in Peru and its current reality?
Yes, of course, Tandy. Peru is under state of emergency since March 16. And even though the measures are the most strict probably of the region and of the world, the numbers are still quite high. Right now, there are more than 240,000 cases of positive COVID-19, and unfortunately, more than 7 people have died because of the illness. The hospitals currently are at its full capacity, and this is affecting, of course, the most vulnerable people, that are the poor, that are the people Cuso works with. The pandemic was announced one Sunday night, and the state of emergency was announced one Sunday night, and it came into effect the next day. So we didn't have a lot of time to prepare. We actually didn't have time to prepare. At the time of the announcement of the lockdown, we still had some volunteers from Canada here in Lima. So my team and I work basically to repatriate those Canadian citizens with the support of the Canadian Embassy. So that was done all remotely, and we could send them back. And some of the volunteers who were here included 2 communications advisors, one of them working for the office, and then we had an agroecological advisor also working for the urban agriculture project that we have in Lima with an organization called IPES, and all of them were sent back. We still have one South-South volunteer from Bolivia, Ronald Anzoleaga, who I believe is with us right now. And he is still here. He got trapped. He was about to catch the flight to go back to Lima, but he couldn't do it. So he has spent the last 3 months in quarantine here also in Lima.
Thank you for that.
Sorry. No, that's what basically we did during the first times of the quarantine.
Thank you for that overview, Pilar. So my next question is, you've given a bit of a background about the current reality in the quarantine. What is it like living in Peru during this time? What is it like working during the current context? And how have you and your family been impacted?
Well, it is something that we were not prepared for. So the first thing we had to do, and I include my team as well, because we have done a transition from working in an office to working from home. Currently, I'm working from my office, which is my dining table. And we have had to accommodate ourselves to this new way of working, having virtual meetings, for example, and not being able to see people, but we go along with that. In my case, my extended family live in Nicaragua. I am not Peruvian. I was born and raised in Nicaragua, and my parents still live there, as well as my siblings and all my family. So my thoughts are always with them, because Nicaragua is a very impoverished country that in the normal situation don't have the basic health service to support the people. So imagine now with this pandemic, it's even worse. Also, I have 3 kids that are in different parts of the world. I have 1 kid in Montreal, in Canada. I have 1 kid in Costa Rica, my daughter. And I have a son who lives in another district in Lima that I also haven't seen in 3 months. In my case, what we do is my husband and I divide the house chores. For example, he is in charge of do the grocery shopping because his time is more flexible than mine. I prepare dinner every day, and we have our own routine established. And I think it's the same for my team and for all the people who are working from home. And even though it's very stressful for me, and I'm sure for everybody who has experienced this working situation, we belong to the privileged group. I still have my job. I have a house that I share only with 1 person, with my husband. So if I put all the measures in place, I will be safe, which is not the case for millions of Peruvians.
Thank you. That leads me to my next question. So how specifically has the quarantine impacted everyday people in Peru? And I'm thinking specifically about groups or populations who may be more vulnerable, such as women, for example.
In Peru, people have had a tremendous impact. Peru's economy is mostly informal. Actually, 72% of Peru's economy is in informality, which means that you're not covered by benefits, you don't pay taxes, but you also don't get what you need if you don't go out to work. And there is a quarantine in which we receive a mandate to stay home. Actually, the government provided a bonus called Yo Me Quedo en Casa, I Stay Home bonus, for all the families in Peru. This bonus is the equivalent of around 300 Canadian dollars, but when the quarantine lasts for 100 days and you have a large family, you can imagine it is very hard to go by with only that. Also, people got trapped in Lima when the quarantine was announced. They didn't have time to go back to their provinces. Peru is a very centralized country, and a lot of things happen in Lima, including specialized healthcare. So many people were here running errands, and they had to stay. Many of them spent weeks sleeping on parks, including children. Also, let me tell you that there are many indigenous people living in Lima looking for better opportunities for their families. And these people decided, because they didn't have a transportation to go back to the places, decided to walk, some of them for hundreds of miles with their kids and families to go to their provinces of origin. So it's been tremendously hard. What else can I tell you? Normally, the households are very small and many people live inside, which makes social distancing very challenging. For women especially, it's more challenging because we know that women in Latin America have the burden of the house chores. Normally, they provide care to the sick family members. Now they have to homeschool their children because there's homeschool due to the pandemic. And sadly, many times they live with their aggressor. And gender-based violence cases have increased a lot in Peru lately because families are together and there's a lot of tension inside those walls. Tensions that include not knowing what is going to happen in the future, not knowing if they will find a job, for example, and not knowing what is going to happen after the pandemic.
Thank you, Pilar. So building on that, I'd like to take the opportunity for you to talk a little bit about how Cuso is working with local partners through a project funded through Global Affairs Canada, our Women's Voice and Leadership Project, where the prime focus is to promote the women's right and their empowerment, which is so imperative during these difficult times. Can you share a little bit about what the main objectives of this project are?
Yes, of course. And first of all, let me tell you that Cuso has been working in Peru for 50 years. And we have been working in gender equality for decades. And gender equality and empowerment of women is the rationale behind this project. This project is called Women's Voice and Leadership and is a 4-year, $5 million project funded by the Canadian government with the support of generous donors of Cuso International. And it's being implemented in 14 regions of the country by 4 recognized women's rights defender partners that I will mention right now. They are DEMOS, Estudio para los Derechos de la Mujer, ONAMIAP, which is the National Indigenous Organization of Andean and Amazonian Women in Peru, Movimiento Manuela Ramos, and Flora Tristan. So these 4 organizations are working in these regions, and we are aiming to reach 180 local organizations to defend the rights of women, to train 475 young women, including public servants and young feminists. And there is a strong component of this project as well, aiming to strengthening these implementing partners so they can continue with the women's rights agenda longer than the project has concluded. Within this project, there is a mechanism that we call fast responsive funds that it was designed to respond to emergencies. We never thought, and the authors of this proposal never thought, that these fast responsive funds could be used for a pandemic scenario like the one we're living now. But it is actually been very helpful for the partners. And 3 of them have already applied to use these funds.
Great, thank you. And I was wondering if you could just share maybe a personal story of some of the women that we're directly working with through Women's Voice and Leadership. I know you've shared a lot of information with headquarters and with Global Affairs Canada. Can you provide us an example of how these types of funds are directly reaching women and their families?
Yes, our main interest and aim is to support the most vulnerable women. Women like Rosa, the one that you see here, accompanied by her children, her grandchildren. Rosa is a woman who is 53 years old. She is from Puno, a region in the Andean, in the Peruvian Andean. And Rosa became an orphan at the age of 7. After that, she was taken to Bolivia to serve as a domestic worker. But she could escape from that situation when she was 13 and decided to go back to Peru. She described that time as one very hard for her and a very exploitative situation. When she was 20 years old, Rosa decided to form a family of her own, but also she decided to become active in defending the rights of women in her community. And she's been doing that ever since. She's been promoting the prevention of gender-based violence in the communities. And women like Rosa, that is the only breadwinner of her family, are receiving support from these small funds. As you can see in the picture, Rosa is receiving a package of basic items, including food and sanitation products. Not only Rosa received this benefit, but also many other women and hundreds of people, if we count the family members, have received this type of benefit from the partners that are using these funds. And other things that our partners have done with the fast responsive strategic funds is to provide social, psychosocial support to women that are going through tremendous levels of stress and are calling these numbers of the psychologists. And, you know, the calls include women that are depressed, anxious, with a lot of fear because they don't know what's going to happen, women that have lost a close family members that need support, and also women that are facing gender-based violence. With these funds, we are also, our partners are also spreading messages through radio spots in languages, not only Spanish, but also including Quechua. And they are also distributing personal protection equipment to, for example, a group of obstetricians from Cajamarca. They sent a letter to our partner organization, Demos, that they needed face masks. And they provided the face mask using the funds. And also to a group of women that got together as a community service. They decided that they were going to make sure that the people respected the curfew, so the pandemic could not continue being contagious. So they are called Las Ronderas, and they work in Cajamarca, so they receive these special suits to support and help people stay inside their houses. Also, funds have been used to spread virtual messages and how to wear personal protection equipment like face masks, how to properly wear them. So those are only examples of what is being done with these fast responsive funds from the Women's Voice and Leadership Project.
Thank you very much, Pilar, for that comprehensive overview.
And thank you, Tandy, for facilitating that conversation. Once again, I think all of your essences came through of what we're doing in Peru around COVID-19 and the pivoting around the pandemic. For those who had some technical glitches in Peru, we do understand that it's part of technology, and not everyone has that opportunity to have that clear crystal online technology that we do here in the West. But we heard everything you said, and we thank you for that, Pilar and Tandy. Just before we continue on, I'd like to play a short video that summarizes what Pilar just spoke to.
The main objective of this project is to ensure the full exercise of human rights by women and girls in 14 regions of the country, and it will benefit 180 women's rights organizations, because women and girls in Peru face a lot of struggles. If we see a reduction in gender-based violence cases, if we see advances in gender equality, and if we see women rights organizations strengthening, it will mean that the project has been successful.
So that's a summary of the project that was just spoken to. And now I'd like to share the poll results from question number 1. So the question was, have you ever traveled to Peru? And from the audience that's participating with us today, close to 50% of you have, and the other 36% will get there at some point. So thank you for participating, and I will share our second poll with you momentarily. So the second poll that's being launched right now asks what you've just heard, the conversation between Tanya and Pilar. From your perspective, how important is it to support women during the COVID-19 pandemic in Peru? And your question selections for those of you using a computer are very, somewhat, or neutrality. And so I'll leave this up for a couple of seconds. I see everyone furiously putting in their answer. I appreciate that. I do have to continue with time. So I'm going to end the poll and continue on. We'll share those results in a little bit. As Cuso International improves lives and shares skills throughout different Latin American countries, Tanya, maybe I can start understanding better and looking at Colombia and Honduras. What has Cuso been doing there, and how are we course correcting throughout the pandemic?
Sure, thank you, Tina. First of all, I would like to thank our many donors who have been supporting our work in Latin America and the Caribbean, including Global Affairs Canada, the European Union, CBM International, as well as our numerous individual donors that are supporting Cuso on a monthly basis. So thank you very much. I will start a little bit by telling some of the examples of us working directly with local partners to identify ways that we can cost effectively, efficiently mitigate the impact of COVID on women and other vulnerable groups, including youth, Indigenous people, as well as persons with disabilities. In Colombia, we're also working with Venezuelan migrants. So this has been the main focus of Cuso since the beginning of March. In Colombia, through funding provided by Global Affairs Canada, we have quite a large project called Sustainable Colombian Opportunities for Peace Building and Employment that provides decent employment opportunities to vulnerable groups such as women, youth, victims of the conflicts. Now we're including the migrant population from Venezuela, as well as Colombians who are now returning to Colombia after being outside of their country due to the conflict. The idea is that recognizing that such individuals have challenges, certain barriers in accessing income generating opportunities, the focus really is to provide training and link individuals to decent opportunities. During this time, however, with COVID, we've seen a significant impact on the private sector companies with whom we'll be working with. So immediately, Cuso designed a contingency plan in coordination with private sector companies so that we could really look at how can we support newly employed individuals who may be impacted by COVID. So with commitment from the private sector companies, as well as Global Affairs Canada, we've been able to provide cash assistant transfers to individuals so they are able to purchase food and other supplies during the crisis, with the idea that we're helping them get through the worst period until things begin to return to normal. We've also been providing employees who are now forced to work from home with access to internet. We've mentioned this today in our town hall meeting, that there's a lot of people who don't have access to internet, or the internet is very weak. And in order to have them continue working, we're providing them with that access, as well as any necessary equipment such as laptops that they may need to keep working from their home. We've also been working with private sector companies to provide biosecurity kits to ensure that workers have proper protective gear while they're on the job site. There's a lot of workers, such as Venezuelan migrants who are newly employed. They don't have a lot of disposable income. We're enabling to access that protective gear so they're able to continue working during COVID. Just as Pilar has mentioned in Peru, we're also seeing a significant impact on the mental health of individuals that we're working with. So part of the SCOPE project was always to integrate psychosocial support for individuals who require it. But during times of extreme isolation, we're seeing there's those increases in anxiety and depression, and this directly impacts how an employee may perform in the job. So we're ensuring that within the company, we can provide psychosocial support to employees so they can continue working. This is significantly important for female victims of the conflict, as well as female migrants who, as Pilar mentioned, these groups are also dealing with childcare. They're dealing with a lack of family support because they're not able to meet with family members, for example. What is most important, I think, in our strategy is the impact of COVID on companies. I mean, that a lot of companies have had to downsize, they're laying off workers, and in some cases, they're even closing. So what we're doing is working with private sector partners to see how we can support them in virtualizing their recruitment and hiring practice. In Colombia, for example, there's a number of sectors who are still operating, such as those providing cleaning and sanitation services. So they're repeatedly recruiting and looking for new people. But what we're doing is, because we cannot have face-to-face interviews or face-to-face training, we are now working with the companies to use technology and applications so we can better facilitate the linking of individuals with jobs. And as a result, to date, Cuso has helped Cuso has helped to ensure that 90% of participants who have been recently linked to employment have remained employed. So that for us was always the main goal as part of this project, is really to decrease the risk of COVID, but also ensure both the social and economic well-being of those participating in the project. In Honduras, it's sort of a completely different context. In Colombia, we're really focused on the urban areas. We're working in 8 cities across Colombia. In Honduras, we shift to providing support to rural communities that are located in some of the most remote and marginalized part of the country, significantly in the dry corridor. We're working on a project funded by the European Union and CBM International that provides training opportunities to vulnerable groups, specifically women and persons with disabilities, who don't have employment opportunities in the communities where they live. So we're providing business development training that's allowing these women and persons with disabilities and other community members to generate an income by starting micro and small enterprises in rural areas. In many of these communities, this is the only source of income that is available. So in the context of COVID, we need to think about what can we do to better support the communities we're working with. In many cases, individuals in such communities are cut off from urban centers, so they need to have access to necessary protective gear and supplies for their families. So what we've been doing is working with our donors for the project to ensure that we can assemble emergency supply kits that will be delivered to families in communities so they have that extra support during the crisis, and once the crisis has subsided a bit, then the families are able to get back on their feet. And I must point out that, I mean, I visited these communities. This is 4 hours in a vehicle where really in the middle of, you know, a dry area, there's no opportunities. They're very small communities. So you can imagine with the onset of COVID, they weren't selling protective gear before COVID came on the scene. So it's important that we're there to support them. But also for Cuso, it was really important to recognize the importance of supporting micro and small businesses during COVID, because we know the tremendous impact in a lot of cases in communities. If they're producing something that's going to be sent to an urban center for sale, we know that that's going to be impacted. So what we've been doing is really ensuring that we can continue to provide support to the business owners to continue with their training. So for example, we've been able to provide training through WhatsApp, which everybody in a rural area, they may not have a super sophisticated smartphone, but they have some type of a phone. So we've been able to continue the communication, providing coaching and mentoring. Something that has also been accessible for us is the communities have been impacted that maybe they're not able to send their produce to market, but they haven't been impacted by the high infection rates in other areas. So they're still working. They still want to participate in training. They still want to be involved. So we're also looking at other ways that we can provide online training. Our territory coordinators are able to move around the country, so they're following up with communities and ensuring that they feel sorted and they can continue to work on building their businesses during this time. In urban areas, Cuso is also working with our local partners to strengthen online support for services. We know in times of crisis that women are more susceptible to violence. So we are working with leading women's organizations to ensure that women have access to online support, counseling, and other types of services so that they feel that they're safe. We're also working with local partners to ensure the rights of persons with disability who are also considerably vulnerable during this time, ensuring that they're accessing services, that they're being taken care of, that they're being provided with supplies as needed. I think my message is that, Cuso will continue to look for ways that we can support both our partners and the local communities that we work in. And we're also looking for other types of strategic partnerships. Who can we work with to help expand and grow the impact of the activities that we're doing to support the most vulnerable communities in the region? So thank you.
No, thank you. That gives us a very clear understanding of kind of the context of scope and the different programs that Cuso is involved in, and more so the skills building and opportunities that we're offering to Colombians and Hondurans. So thank you for that, Tanya. Now I would like to share the second poll results with you. And the question to that question was, how important is it to support women during the COVID-19 pandemic in Peru? And close to 100% of you said it's very important. So once again, thank you very much for your participation. It is now an opportunity for all of us to get your questions answered. So once again, I know there's been quite a bit of chat and raising of the hands, but there is a Q&A button that will facilitate the direction of the questions. So if you wouldn't mind just taking your time and typing in your question in the Q&A box, and we'll get started with facilitating that session. So I'm in the Q&A box right now, and it's very active and live. So we have one question coming in. Thank you very much. It's ironically around adapting to online technology and virtual conversations like the one we're having today. The question is for Pilar, and are Peruvians, our citizens of Peru, able to simply go online and connect and do their day-to-day like we're doing in the West? So I'll let Pilar answer that question.
Okay, let me start by telling you that it's been very challenging. I have a laptop, I work for an international organization, and I have a decent internet service. But can you imagine working in 14 regions in country, or with indigenous people, indigenous population that don't have access to that? So I forgot to mention, and it's a good opportunity to mention, that we are doing some course correction to the project of Women's Voice and Leadership in order to close that gap and make available for those people or those local women's rights organizations in the communities to have access to virtual platforms, to have access to cell phones that can be used with internet or WhatsApp. It is challenging, and definitely we will need resources to do that, and we're working on that. It is challenging, but it's something that I think provides an opportunity to close that digital gap that exists, and it's more visible now.
Absolutely, I agree. And another question that's come in more around policies. What cracks in the system and or policies is COVID-19 uncovering? And maybe as HOPS, head of programs, you can take that question, Tanya.
Sure, that's a great question. It's a relevant question because in both countries, in Colombia and Peru, before COVID hit, Colombia and Peru were both dealing with the influx of the Venezuelan migrant and refugee population. So governments were then not scrambling, but really trying to figure out how can we best react, how can we best support. And in the cases, I think you would hear a lot of comments that Venezuelans most likely will not return to their homes. So you need to look for strategies to integrate. So now with COVID, what we're seeing is countries now are asking the question is, how do we deal with this new pandemic, and how do we respond with policies, that will help with economics, right? So how do we get economies back and going? A lot of social policies in place are going to see that there's going to be rises in abuse, violence against women. So we need to look at that. So I think what we see in the country is working side local partners. In Peru, it's a very good example how our local partners are already advocating and speaking with politicians and other individuals to address some of these issues, which are now going to be exacerbated with COVID. So we've definitely seen that there's a response. I think there's a role that Cuso and other organizations can play in providing guidance to local governments about what are the needs of the most vulnerable groups. I think that's something we've done quite well in Colombia, in what are the needs of vulnerable groups and accessing decent employment. So we're looking at how can we create more inclusive employment policies and programs. And in Peru, it's something, you know, that Pilar focuses on a daily basis with the local partners, is how can we help governments at the national and subnational and local level respond better to these type of crises.
Absolutely. Thank you. And here's another question, if you allow me to just rephrase it a little bit. I think they're asking how do we support women during this pandemic? What are groups asking for? And what are the resources? Is there a list of resources that they need? So I will
Laura respond to that one. She's on the ground and is working directly with local organizations and understands best the needs.
So I guess just to elaborate a bit more, the question is around resources and what are people asking for on the ground?
Well, definitely resources are needed. That's a fact, even now more than ever. People are asking for all they need, and they need jobs in order to survive. They need food, they need shelter, they need medical care, they need basic services like clean water, for example. They need access to information, to psychosocial support, and we are trying to cover as much as we can with the resources that we have in Women's Voice and Leadership Project, but it's not possible to do that. We wish we could do more, and our partner organizations are very active identifying the local needs and bringing those to us. And definitely, we need a lot of support. I don't know in what words to say it, because this pandemic has affected us all, but when you live in countries with huge gaps and inequalities, it's even more relevant. It is exposed, and definitely we need resources. So any kind of support from our generous donors, from governments, and we are working hard. I mean, Tandy and the team in Latin America are working hard, thinking about ideas and how to create proposals to bring those needs to have been met in order to improve the lives of those that need it the most.
Absolutely, thank you. And here's a question around M&E. They ask, I know that updating projects can be lengthy, but how fast were you able to adapt to the current situation given planned objectives and M&E goals? And they're just asking us to share some experience.
Sure, I can comment. First of all, I mean, in the region, we are implementing 3 large bilateral projects. I think what I was so impressed with my team, and Pilar is part of that team, is just how quickly teams started to brainstorm and how can we shift or modify activities, because in a lot of these projects, the end goal is really the social and economic well-being of the individuals we work with. So I would say, I think COVID, we started to see it mid-February, end of February, beginning of March. And at that time, even sort of the senior director of Cuso was asking questions to the team, how now do we best react? So I think in the case of Peru, I was very impressed. Our one partner, Manuel Ramos, I mean, Pilar's reached out to me right away. We need to have funds to support women who are going to be affected more by violence. And I was like, sure, that's an amazing idea. Or they're asking for supplies for the LGBTQI community, which in a lot of places they're forgotten. They're not seen as needed in the same scenario. So we were very, very quickly able to turn around and provide support where needed.
Excellent. And just continuing on, I'm looking at a time watch. We do have a couple of more minutes for maybe 3 more questions. One is around our Indigenous work. How does Cuso support women in remote Indigenous communities in the Andes and the Amazon region that has been hit so hard with COVID-19? So
that's a very good question. Actually, 26% of the Peruvian population are Indigenous people, and they live, they are the most vulnerable, definitely, and they live in very outlying places, very difficult to reach, and they have very scarce health service. So what the indigenous people or communities have decided to do in Peru is to close themselves. They have locked down their communities because they don't want the virus to come, but still they are already being affected by the virus. So the project, one of the course correction of the project in the future, and we are in the middle of the planning part right now, is to provide them with more access to medical and healthcare, more access to sanitation products that they don't have the means to buy, more prevention training for COVID-19. I mean, they need to be training how to prevent this illness. Those are some of the things that we're doing. Also, we are planning to bring the trainings, instead of being presential training or in-person training as we had planned at the beginning of the project when we didn't think about COVID. Now we're thinking about bringing them virtual trainings, establishing platforms and establishing some centers where they can go, or some of them can go and receive the training from Lima or the places where the trainers are, and then bring the training content to their community so that we'll keep them safe from the infection. Those are only some examples.
No, thank you very much, Pilar. And another question that directly speaks to the Women's Voice and Leadership Program. They ask, how well supported is this initiative from a local, regional, national government and the populations in general?
And this is from Women's Voice and Leadership, sorry.
Correct.
Yes, it is supported definitely first by our donor, the Canadian government through Global Affairs Canada, and the private donors from Cuso. In Peru is very well received, of course, because it is a project that is, which aims is to women and girls exercising their full human rights and also advancing in gender equality. We will always find some reaction, especially from conservative groups, but it is well supported by the 4 implementing partners. They are very well known women's rights organizations that have defended the rights of women for years. Locally, it is supported as well. In the 14 communities, as I told you, we are working closely with 180 local partners that are supporting this initiative, and definitely by women who are the ones who will receive the benefits of this project.
Thank you very much, Pilar. And I think looking at, excuse me, time, we're gonna kind of go to our final question. How are the 2 countries reaching communities along partners due to the increase of gender-based violence now that the cases are at an increase? Men and women are spending more time at home. So how are we going out into the communities along with our partners, specifically to reduce and mitigate gender-based violence that has been on the increase now that both men and women are spending more time at home?
As I mentioned before, some of our partners are spreading messages to prevent gender-based violence during this pandemic because they know the couples are inside the same place 24/7, so they leave a lot of tension. So they are sending messages about gender-based violence related to the pandemic, related to the lockdown and the quarantine. There is a hotline in Peru, La Línea 100, where women that feel affected by gender-based violence or people that know of a case of gender-based violence can call to report the case. There is psychosocial support to the victims of gender-based violence as well. That definitely numbers have increased during the time of pandemic, and those psychosocial support is there for the women that require it. Our partners have been very active doing that. For example, our partner Manuela Ramos is working closely with the Ministry of Women and Vulnerable Population in Peru to spread out messages to support La Línea 100 or the hotline, and to write a handbook of gender-based violence prevention to guide women on how to identify gender-based violence and how to denounce gender-based violence cases.
And if I could just add one thing, Tina, in Honduras, we've been working with the National Institute for Women on an online tool which anonymously allows all individuals to access and take a survey to see if they're in an abusive relationship. So definitely during this time, we are working with this government partner to ensure that people are aware that this tool is available. And what it does, it helps people think about, am I in an abusive relationship? Is this abuse? And then from there, linking them to services, tools, other types of support that may be needed during this time, but completely anonymous and open across Honduras, but also across Latin America.
Thank you, Tanya and Pilar. So we're definitely making an impact and realizing the issue around gender-based violence in all the countries that we work. We are looking at time coming to an end, and I want to thank Pilar and Tanya, and specifically you, our audience. I really apologize. I've tried to triage and go through all the questions. We've had over 40 questions. I think we got through 5 within our time limit. I would like to hand the microphone back to Tanya and Pilar to say any final comments they would like. Very briefly, but I offer that up to you now.
Sure. I mean, I think on my end, first of all, it's really important to say thank you to everybody who's been working tirelessly, extra hours, long days for the repatriation of volunteers, but also working alongside our partners to ensure that they have the resources they need to move forward to support our communities. I would say that Cuso, we continue to look, I think as we move forward in implementing new projects and programs, it definitely will be a new component. This is the new reality when we look at pandemics and how people move and relate to each other. So for us, it's also a new challenge, but we look forward to being able to continue to work on the ground and support the communities we work with.
Pilar?
And yes, I really would like to thank our partners, the partners implementing the project, the women's right organizations across the country, the women that work very hard, like Rosa, for example, that despite the challenges that they have lived through their lives, they have committed themselves to defend the rights of other women like them in Peru, and that our partners are working with. I really would like to thank my staff for being so flexible, for being resilient, and for being able to continue working under these new circumstances. And definitely our donor, the Government of Canada, the private donors that support Cuso. We do a very important job, and you can see it from this presentation, and we love what we do, and there is a reason to continue doing that. Yes, that's all I have. Thank you.
Thank you, Pilar and Tanya. We love what you do as well. So to conclude, for nearly 60 years, Cuso has connected communities around the world with skilled Canadians to end poverty and inequality, and we're not stopping now. If you would like to help make a difference, I encourage you to subscribe to our newsletter, follow us on social media, visit our website, and become a donor. Your actions through giving will affect meaningful and urgent change for women and girls in Peru, Colombia, and Honduras. Our website is www.cusointernational.org. And I would like to mention, just in follow-up, that we will respond to all of those questions. We just didn't have time to do it today. Thank you for your participation. We also will be sending out a short email that will contain a 2-minute survey. Please, we ask that you just take those 2 minutes to fill it out. We would love to get your feedback, and it helps us give us direction for the next town hall. As well, you will all be receiving a video of this town hall today. So once again, thank you for supporting Cuso International, and in solidarity, bye for now.
Thank you.